The 89th legislative session is in full swing. Thousands of bills have already been filed by legislators. The debate details on bills can get overlooked, even on critical legislation. That's why we've asked legislators to come to TPPF to discuss their bills to ensure you are on top of the most important issues making their way through the Texas Capitol. This is The Layout. I'm Nicholas Armstrong, policy analyst for TPPF's Center on Health and Families. Today, we're discussing HB 3708 with Representative Tom Oliverson from House District 130. Representative Oliverson, welcome to The Layout.
Thanks, Nick. It's a pleasure to be here with you today.
HB 3708 would require nonprofit hospitals to screen patients for its charity care program before they can send a patient to debt collections. Can you tell us what sparked the need for this legislation?
I mean, to be honest, this is one of those pieces of legislation where you all came in and we talked about it, and I was so struck by the information that was presented. I said, I have to file this, and this absolutely has to pass. Just the idea that a hospital that's receiving a tax exemption for providing charity care is actually not fulfilling the terms of that obligation is so frustrating to me that this is one of those things that just had to be dealt with.
Yeah, certainly. Can you take us through and walk through the bill and describe how the bill works and how it operates?
Right. So basically, all hospitals in Texas, to some extent, whether they get their tax exempt or whether they're for-profit, provide charity care because federal law requires them to. If somebody presents to the hospital and they're having a medical emergency or a pregnant woman is in labor, you can't decide whether or not you're going to provide them care based on the ability to pay. And so what we've uncovered is that there's really not much difference in terms of the amount of charity care being provided by a for-profit hospital and not-for-profit hospital. And in fact, the not-for-profit hospitals, the tax-exempt hospitals, if you will, have engaged in some pretty bad behaviors around their charity care, like actually sending someone to debt collections and writing it off as bad debt and saying that's charity care. So the bill basically seeks to close all of these loopholes and require the hospitals that are getting the tax exemption to actually live up to the terms of you are getting the tax exemption because you're providing this amount of charity care.
Mm-hmm. No, certainly. And you touched on it a little bit, but how would the lives of Texans, everyday Texans, what would be the impact of this legislation on their day-to-day life?
Well, I think we start with the majority of Texans. I think according to one research poll, it was more than 80% of Texans don't even know that hospitals have charity care policies, let alone how to access them or whether they would qualify. And so, I think the number one impact that this piece of legislation would have is that it would require these hospitals to inform people about their rights under the charity care that they're already offering, but not really offering in exchange for that tax exemption. And then beyond that, it would require the hospitals to screen everybody that came through their doors to see whether they would qualify for the charity care. So you could be an uninsured patient and have an accident with a power tool and need to go to the emergency room for stitches, and you don't even realize that you would be eligible to have a large portion or maybe all of your bill written off under the charity care guidelines. And so instead you go home and you get a bill for $6,000 or more that you can't pay. And you have a choice as to whether or not to put that on your credit card, and you still can't afford to pay that, or let them send you to collections and ruin your credit. So I think the impact could be huge.
Yeah, that certainly sounds like it would affect large population of the state. And then some have said that that pre-screening requirement would add a lot of administrative costs and it would be really expensive. How would you respond to those claims?
So the value, by my calculations and the data that we have, of the tax exemptions that they are being granted by the state totals $2.7 billion per year statewide. And so I personally think that if they're going to be, it's not like we're asking them to do something for nothing.
Yeah.
They are getting a tax exemption and have been getting a tax exemption for years. And as one of my colleagues, Chairman James Frank, pointed out, there really isn't an appreciable difference in terms of what a hospital that doesn't qualify for this exemption and a hospital that does qualify for this exemption does in terms of the amount of charity care, the way it's being applied. So I think if they're going to get the tax exemption, then they should have to screen everybody. And if they're not comfortable doing that, then as Chairman Frank said, perhaps we should just eliminate the tax exemptions altogether and just put everyone on a level playing field.
Yeah, that would make a lot of sense. And then what kind of feedback have you received from other legislatures or other legislators or members back in your district? What have you been hearing from some of the feedback on this bill?
So the feedback has been uniformly positive, and I think it's interesting in that occasionally you will file a bill that's sort of a sleeper hit of the session, and it's one of these things that people didn't really know that they needed until they suddenly realized what the issue was all about, and then suddenly it just takes on a life of its own. The last time that happened to me, really, I think the closest one I can think of is in 2019 when Senator Hughes and I created the shot clock for site development to help reduce the cost of housing in our state by forcing cities and counties to come to the table in a timely fashion with developers to approve these developments. Sometimes these bills just take on a life of their own. And so this bill, 3708, has suddenly become a surprise hit. I think the only people that don't like it are the hospitals that are getting the tax exemption but not really providing the level of care they're supposed to be in terms of charity.
Well, thank you, Dr. Oliverson, for joining us on The Layout.
Thank you.